Health Minister Mark Butler stood up today to hose down allegations of pork barrelling over Labor's pledge to open 50 new urgent care clinics in a second term. He says the decision reflected the geographical spread of need across the country.
Well, I think it's a beat up. If you look at the 50 seats I announced yesterday, about half of them are in Labor-held seats and half of them are in non-Labor held seats, which reflects the makeup of the parliament. The important point, though, is that these locations have been chosen according to our analysis of hospital presentations in local hospitals, as I said, bulk billing data, and that desire to ensure an even geographical spread.
Independent MP for Kooyong and Dr Monique Ryan is sceptical of the government's plans for urgent care and wants modelling on their cost effectiveness released. Monique joined us earlier. Monique Ryan, welcome to the program. Over the weekend you called on the government to release modelling demonstrating the cost effectiveness of urgent care clinics. You've said you're worried about pork barrelling. What are your concerns here?
Thanks, Olivia. Well, look, in the last 2 weeks, we've seen the federal government commit $8 billion, I should say, to Medicare funding, and the opposition very quickly agreed to fund it, although we have no idea exactly what their plans are around healthcare funding. In the last 18 months, we've seen the Albanese government put over $1 billion into 87 urgent care clinics. And as of yesterday, they've said they've got another $644 million for another 50 clinics. But my question is, are the urgent care clinics doing what they're supposed to do? What they're supposed to do is take pressure off emergency departments and give Australians an opportunity to receive best quality health care out of hours without having to wait 2 or 3 hours or longer to be seen in an ED. My question is, are they working? Are they doing what they're supposed to do? Are we getting cost-effective care, or are we actually doing something which could have potentially unintended negative consequences and have a significantly negative impact on GP services in this country? GPs don't like the urgent care clinics. They've got concerns about them. I'd really like some evidence from the government before we put another huge swathe of money into this program that it's working.
Okay. There does seem to be a bit of a split in opinion among the medical community when it comes to the effectiveness of urgent care clinics sort of generally. Would your views be different if they were doctor-led instead of many of the urgent care clinics being nurse-led, for example?
Oh, it's not about whoever's providing the service. It's just about the service that's being provided. And I think everyone thinks, great, an urgent care clinic, this is fantastic. I can go and get free service. I don't have to go to an ED. Out of hours, there'll be someone there and they'll be able to help me out. The concern is that the government's putting a huge amount of money into these clinics, which are existing clinics. They're just giving extra money to these big corporate-led GP clinics, when often there's a GP clinic 100 metres down the road which could potentially provide the same level of service at a much lower cost. And that's what we're looking for, best quality care for all Australians at all times of the day, while providing the assurance, I guess, that we're not, that care is not detrimental to other parts of the healthcare system.
We've seen both the major parties investing billions of dollars or committing to invest billions of dollars in health over the past week or so. How would you prefer the government invest this money in the health system? Do you see kind of any gaps that aren't being filled?
Well, we've had lots of reviews of general practice and general practice provision in this country in recent years. And it was good to see the government put more money into Medicare recently, the $8 billion that they committed. But they haven't actually followed the advice of those independent reviews, which is that we need to move away from fee-for-service, where doctors get paid for seeing people when they're sick, and we need to move to different models of care where doctors get paid to keep people well. There are ways that we can do that, but we're not addressing those fundamental issues with the Medicare system, which is an issue when we've got an ageing population with an increasing incidence of chronic disorders. So neither the government nor the opposition is really giving us assurance that they are moving the Medicare system in the way that we need it to move going forward, with an ageing population where we do need to provide a different pattern of provision of care over time.
I wanted to drill down on that bulk billing announcement a bit more. When the Prime Minister made that announcement in the seat of Bass, he was holding a Medicare card, and it struck me that he said people will no longer need a credit card to go to the doctor under the plan. Is that a bit of a risky promise to make, given there are many GPs, especially in inner city suburbs, metropolitan areas, who won't take up the bulk billing incentive because it's not viable for them to do so?
I was out in the streets of Kooyong yesterday and a GP approached me and said, that announcement put the fear of God into her. She actually said her blood run cold because she said, I can't run my practice on the bulk billing incentives such as they are. And so if that's the direction in which we go, my GP practice will have to close. So I do think that there is an issue with these all-encompassing announcements by politicians about these sorts of things. They do tend to come back and bite you. What we really need to do with healthcare, as with defence spending and every other big part of the government's program, is to look at the best evidence for how to achieve the aims that we're trying to achieve. If we look at healthcare, we want universal, affordable healthcare, but we don't have that at this point in time. People are massively out of pocket when they see a specialist. We're about to see private health insurance premiums are going up by 3.7% on average on the 1st of April. There are lots of cracks in our healthcare system that neither of the major parties are looking to address with any foresight or forward planning or clarity about their plans and how they're going to address these in an evidence-based way.
Is it fair to say then that the government's setting up a false expectation then on this bulk billing announcement?
I would have thought that Mr Albanese might have learnt with his pronouncements before the last election about the cost of electricity that these things can be easier to promise than they can be to deliver. And rather than brandishing a Medicare card and making big promises, I would hope that both Mr Albanese and the Prime Minister and Minister Butler would be providing us with a more evidence-based approach to how they're going to improve healthcare in this country in the years to come.
On a slightly different topic, national security, it's now very much on the agenda for the upcoming Australian federal election, given the febrile global environment. Obviously, there are a lot of structural pressures, on the budget, whether that be health, aged care. Do you think we need to invest more in the defence space, given recent events?
There is evidence that our defence spending is probably a little bit under at the moment and that we should review that, and I think that's an important thing to do. But as I've said with healthcare, I think that any increase in spending that the country undertakes should be evidence-based. I was really concerned that the Leader of the Opposition came out yesterday and said that he would like to commit a further $3 billion to purchase of F-35 aircraft, given that the Defence Strategic Review last year concluded that that was not the right direction for our government to go. So I would hope that any increase in our defence spending, which might well be warranted given the current instability globally, would be evidence-based and would take into account a really reasoned and rational evaluation of our future needs and what can be deliverable in the short and long term.
You've mentioned before that in your seat of Kooyong, the cost of living, house prices and climate change are all key issues. I'm curious, what feedback have you been receiving, perhaps over the weekend, regarding Donald Trump, Ukraine and the Chinese naval vessels that conducted those live-fire exercises off Australia's coast?
It was really interesting, actually. I was door knocking over the weekend. My team door knocked 2,000 homes in Kooyong over the weekend. And people are concerned about safety, but they're not concerned about international safety. They're actually concerned about safety locally, about community safety and the incidence of youth crime in Kooyong, which is really, really high. So rather than Mr Dutton putting $3 billion into F-35s, my community would like the federal and state governments to work together on community safety and policing. That is the issue which is most front of mind within the electorate of Kooyong in recent days.
Can I quickly ask you, in 20 seconds or less, will you outline who you'll support in the event of a hung parliament before voters head to the polls?
I'd be really happy to support either major party if, in the incidence of a hung parliament, they will bring to the people of Kooyong appropriately evidence-based policies on how they're going to deal with the economic challenges of our time, the housing crisis and the climate crisis. And I'll support them if and when they do that.
There's speculation either side of politics will be able to form a majority. Just lastly, would you be willing to be a speaker in the event of a hung parliament?
I'm an independent, I'm a proud independent, and I have every intention of remaining a proud independent and not taking on any other significant roles in any future parliament.
Monique Ryan, thank you so much for your time today.
It was a pleasure.